Welcome to the Carevix training by Aspivix. My name is Daniela. I'm a clinical sales specialist with Aspivix based in Orange County, California. Aspivix is headquartered in Switzerland but has a subsidiary in the US and in France. I'm sure you're all very familiar with the current standard of care tenaculum. Over 100 million women globally are affected by its traumatic use. Specifically, patients suffer from pain in 89% of cases, 17% suffer from severe pain, and 29% suffer from bleeding and lesions that require specific procedure that can add up to 4 minutes extra time. The most common use case for tenaculums are IUD insertions and removals, the most cost-effective contraceptive method with over 99% efficacy, but 37% of women avoid having an IUD placed due to the fear of pain, and 75% of women requested pain relief options. This is why we invented Carevix, a new suction-based approach instead of the tenaculum. It's the only clinically proven atraumatic cervical stabilizer. You can see it won a lot of awards. Most recently was named Time Best Inventions of the Year. It has CE clearance and is already in use in Europe and has FDA clearance for use in the US. Clinical studies have demonstrated up to 73% pain reduction, up to 88% less experience of severe pain, and 83% bleeding occurrence reduction. Patient satisfaction is very high with 94%, and it's already used in over 1,250 women worldwide. Carevix can pretty much be used in any procedure where you would use a traditional tenaculum, such as IUD insertion and removal, surgical abortion, IVF procedures, and others such as endometrial biopsy, hysteroscopy, hysterectomy, and so on. There is no or limited change required to the transcervical procedures, which should ease adoption. Now let me take you through how Carevix is used. Its intended use is gynecological transcervical procedures indicated to grasp, hold, and manipulate cervical tissue. The intended patient population is women after the first menstrual bleeding. It's a disposable for single patient use only. However, Carevix may be used multiple times with the same patient during the same procedure. You can find the instructions for use electronically by flashing the QR code on the side of the box indicated in this picture. To open the package, follow standard medical practice to handle a sterile device. You can see here the device is supplied in two separate pieces. The main body that has a piston on one end, and you can see a button on the other end, and the suction head. Carevix is contraindicated in case of a cervical diameter that's smaller than 26 millimeters, which is about 1 inch. And that is because the suction head has a certain size that needs to fully fit on the cervix. As you can see here in the graph, 26 millimeter, 1 inch is really the minimum required. It will fit on anything that's larger than that. It will not fit on any diameter that's smaller than that. Carevix is not compatible with medical devices for transcervical procedures that have a diameter larger than 6 millimeters. You can see the U shape of the suction head has a little hole in the middle, and that has a maximum diameter of 6 millimeters that will fit through that hole. This will work with the most commonly used IUDs that are around 4 millimeters or smaller, so just keep that in mind. There are a few contraindications, such as unhealthy condition of the cervix, such as bleeding, infections, cancer, scar tissue, cysts, polyps, and others. The list is available in the instructions for use. To visualize and prepare the cervix, use a speculum. Remove the cervical mucus, clean and carefully disinfect the cervix and vagina with an antiseptic solution. What's important for Carevix is that we need a dry surface because we're using a suction-based approach. So dry the surface of the cervix with a dry, sterile swab to ensure the sealing and grasping quality of the cervical tissue. The swab may be left on the cervix until you start the procedure with Carevix. If a topical anesthetic gel is used, such as lidocaine, ensure that it's removed before starting the procedure because we need the cervix to be really dry. To assemble the device, we need to put the two separate pieces together by connecting the suction head to the main body. You will see two thick lines on both the body and the suction head. So align the connecting thick marks. Then rotate the main body clockwise until the thin marks are aligned. It's important that this step needs to be performed outside of the patient prior to starting the procedure. To generate the vacuum, ensure that the button is up. You will see the solid oval shaped side with the purple filling. If it's not up, press it up. Then generate the vacuum by pulling the piston away from the main body until an arrow is visible. Once you see the arrow, gently rotate the piston counterclockwise until it stops. Two thin marks will be aligned. Also, this step must be performed outside of the patient. Okay, now I would like you to try it on your demo device that you hopefully have with you. I will show a short video of the steps we just went through. So we put the suction head and the main body together, aligning the thick lines, rotating the body until the thin line is visible and aligned. Now we want to make sure that the button is pushed, so the solid purple button is facing upwards. Now we're pulling the piston away from the main body until the arrow comes and the two thin lines are aligned. This will generate the vacuum. Now we're ready to place Carevix on the cervix. Determine the uterus angle to identify the placement of the suction head. In clinical practice, we've seen better results placing Carevix at 3 or 9 o'clock. This also works well for anteverted, retroverted uterus and horizontal ostium in Paris women. Make sure to apply the suction head firmly on the cervix's outer surface to achieve a good seal. Once it's well placed on the cervix, press the button with the solid purple oval shaped side down to deliver the vacuum. If you hear an airflow generated noise like this, that means that the suction head did not adhere to the cervical tissue. So please, in this case, place the suction head again firmly on the cervical tissue. It's important to wait 10 seconds before starting to pull to let the cervical tissue come into the suction head prior to pulling and manipulating the cervix. Also, please make sure to keep the device and the suction head fairly straight. Now let's try this on your demo device. If you do not have a demo cervix, you may use your hand. It's important to use the rounded area beneath the thumb to mimic the cervix shape, so you need a little bit of a cushion to generate the vacuum. Okay, place Carevix on the cervix or on your hand. Here we're using a 9 o'clock position. Once it's firmly placed, press the solid button down to generate the vacuum. Wait 10 seconds before pulling, and then you can see and try that you have successfully created the vacuum and you can now start manipulating the cervix. Once you're done with the procedure, stop pulling to release the traction effect on the cervix. Press the button side with the hollow oval shape upwards to release the vacuum, and then remove the suction head from the vaginal cavity. Now let's try this last step on your demo device. Just push the button on the hollow side and this will release the vacuum. In case you need to reset the device, it's fairly easy. You just press down on the solid shape side of the button, rotate the piston to unlock it, and then push the piston into the main body until it stops to reset Carevix. Then you pretty much can follow all the steps that we just went through to create the vacuum again and make it ready for use. When Carevix is used for IUD insertions, it's important to remember that the Carevix suction head has a depth of 1 centimeter, which needs to be added to the measurement of the hysterometer. So it is necessary to adjust the position of the flange on the IUD insertion tube to add 1 centimeter to the measurement. Here are 4 tips to become a Carevix master. Tip number 1, ensure good contact with the cervical tissue. It's important to push enough to have a good sealing before pressing the button and to make sure that there's no space between the cervical tissue and the suction head, because this will allow air to come into the suction head and won't make a good sealing with the vacuum. If you hear a noise, you are sucking air and not the tissue. Tip number 2, don't place the suction head too close to the cervical canal. Again, there is an opening which would allow air to come into the suction head. So it's important to position the suction head a few millimeters away from the cervical canal to prevent accidental suction. Tip number 3, push, press, relax. So first push on the cervix to ensure good contact, then press on the button to activate the vacuum, and then relax and wait for 10 seconds to ensure good sealing. Tip number 4, avoid an angle to prevent an accidental peeling effect. So please try to generate the traction in a fairly straight fashion and avoid too much of an angle. Like with any new device, there's always a little bit of a learning curve, and the more you use the device, the easier it gets and the more success you will have. If there is an accidental peeling effect where Carevix comes off during the procedure, you can reuse the same device on the same patients. We recommend up to 4 attempts per patient where we've still seen success. Just be sure to follow all the steps to reload the device and clean the cervix again to be successful. For this initial learning curve, we recommend using the ideal patient case profile, which is a multiparous woman with a normal BMI for better visibility, good cervix size, as we've seen before, 26 millimeters or larger. Put the patient horizontal with a half full bladder for better results. We recommend using a hormonal IUD where the insertion tube is less than 4 millimeters and the use of the 3 o'clock or 9 o'clock position for better results. Some feedback and tips we've received from real-world use is take your time, book more time for the first 5 procedures, Carevix needs a little bit more extra space than a tenaculum. This is surprising to some at the beginning, but confidence improves with experience. Again, the 3 or 9 o'clock position has shown the best results, even with retroverted uteri as well as multiparous patients with larger openings. Lying down the patient with a half-full bladder for retroverted uterus, place a closed fist under the sacrum. Avoid improper vacuum generation. Ensure the button is up. Do not attempt to generate the vacuum on the patient. And ensure proper sealing and to wait 10 seconds before pulling. An additional tip that we've seen work really well is to leave the swab in place as long as possible for optimal dryness and to improve the sealing and grasping quality of the cervix. We've seen high provider satisfaction rates with Carevix. They reported confidence with the quality of the cervical suction, and the manipulation was very satisfactory, amongst other additional positive feedback we've received. Visit myaspivix.us for additional support and resources. Thank you so much for your time and for being an innovator in gynecological care.